I'm going to be talking about heartworm infection in shelters. How many of you are working in shelters that are in highly endemic environments like Florida? So most of you. And then how many of you actually treat animals, dogs that are infected with heartworm? So a lot of you. So I hope to be able to share some tips that bridge the suggestions issued by the American Heartworm Society, which really do represent the optimal way of treating heartworm in dogs that has the best outcomes, but to make them as practical as possible for use in shelters, because frequently shelters find it impossible to administer the very best protocols, so we do have to make compromises. I'll give you some tips about how to compromise on that. And then how many of you are testing cats for heartworm? A few. Is that because, how many of you are testing because you want to test cats for heartworm or because it now comes with the FELUC FIV tests? So most of you are testing just sort of incidentally because you're testing for retroviruses. That's my experience too. And I know that some shelters are actually specifically buying the old combo tests and not the triple test because then they don't have to test cats for heartworm because it's better not to know. All right. So an overview of our presentation today, I'll talk about what we know about the prevalence of heartworm infection in shelter dogs and cats. Briefly, return to veterinary school and parasitology to review the life cycle and the pathobiology of infection. And although this is somewhat tedious, it's very important to understand it in this case because it informs our decision about how and when we test and how to treat. And there is a lot of active research in heartworm disease management today, which is nice because we can make better decisions for our pets. We did a survey last year of over 500 animal shelters on how they manage heartworm disease in shelters, and I'll share some of the information from that. And then finish with practical strategies for managing heartworm infection in shelters, including how we diagnose, treat, and prevent infection. So we'll start with a geographical range of heartworm infection. Certainly here in Florida, we're in one of the highest prevalence places in the country, if not the world. It was first discovered in the United States in 1847. So this infection has been with us a long time, and it started out on the East Coast and has gradually spread across the country so that now it's transmitted in all states except Alaska. So this is a disease that we can track over time its spread with the transportation of infected dogs and the spread of infected mosquitoes. It is now found in more than 30 species of terrestrial and marine mammals, and so we can see it very frequently in dogs, cats, and ferrets in shelters. But dogs and their wild counterparts, such as coyotes, are the only important vector species. So they're the only ones that the heartworms efficiently reproduce in and that serve as a reservoir for infection for other animals, even though many species can become infected. The number of cases in pet dogs continues to be higher each year that this is studied. So despite the fact that we have good preventives that are available to us, the lack of compliance with preventive protocols means that more dogs are being infected every year. There's a number of reasons for these. One is relocation of infected dogs. So we do have to be responsible when we talk about these dog transportation programs, either internationally or from the South and Gulf Coast states up to northern states where there's a shortage of dogs for adoptions, that we're not transmitting infections such as heartworms with those dogs. There are new mosquito microclimates, so we have climate change and global warming, and that is allowing the vector species to be competent for transmitting infections in places where they were not able to in the past. And development even has increased little hot spots, these heat islands, so big cities. If you look at thermal maps of the United States, wherever there's intensive development, there is actually a hotter microclimate. And so even in urban areas, there can be mosquito populations that are now capable of transmitting heartworm because of the increased areas of heat. In the western United States, in some populations of coyotes, over 90% of those are infected with heartworms and are capable of transmitting infection. And this is probably what is going to prevent the eradication of heartworm ever from being a feasible ideal. And then probably the most important reason is that we have poor compliance with preventive protocols. Even though we have excellent preventives available that are essentially 100% effective, there's a large number of pet dogs that are never receiving adequate prevention. This is a chart from a couple years ago that shows the percent of dogs and cats that are on prevention. These are pet dogs, and this is in the Gulf Coast area. And so 41% of dogs in the Gulf Coast receive no prevention at all, and the vast majority, greater than 95% of cats, receive no prevention at all. So you can see that we're doing in our private practices a pretty poor job of assuring that our clientele is protected against infection. And then, of course, neglected dogs and shelter dogs never have that opportunity either. It's estimated that there are more than 1 million new cases of dog heartworm each year. And this graph shows the most recent information collected from 2007 on the number of cases in pet dogs that are diagnosed each year. And this geographical representation really is not a surprise to anyone. We have the heaviest infection prevalence in the Gulf Coast and the South, in the Mississippi River Valley, but also in the foothills of California. It's beginning to be some pretty high prevalence areas, and California still struggles with acceptance of heartworm as a threat to dogs, and a lot of dogs are not on preventive there. Well, what about the situation in animal shelters? We have much less information about prevalence, but we hear that there can be some pretty high rates of infection. We think there's about 3,000 brick and mortar animal shelters in the United States. There may actually be more, but there's no directory nationally of shelters, so it's hard to know how many there actually are. It's also actually hard to know what the intake is, but most estimates that you see will be somewhere between 6 to 8 million dogs and cats are admitted to shelters each year, which is about 1 in 20 of America's pets. And nationally, on average, about 50% of these animals will be euthanized. And so this creates a quandary for shelters, especially if there's a high euthanasia rate. It is difficult sometimes to justify a lot of expensive management of heartworm infection or other problems if animals are likely to be euthanized in just a few days. So what is the risk of heartworm infection in sheltered dogs? We know that dogs that end up in shelters are frequently unwanted, neglected, or homeless, and probably have not received optimal preventive veterinary care. So those sad statistics that we see for pet dogs are probably magnified for shelter dogs. We do have a couple studies that we've worked on in our laboratory. One was a statewide survey of shelter dogs in Florida, and what we found in this study was that about 15% of adoptable dogs were heartworm positive, and that was increased to 24% when we look specifically of the adoptable bully breeds. And we hear this from the groups that specialize in adopting pit bulls and other bully breeds, that they believe that they are faced with a bigger challenge with heartworm, and we do see that repeated statistically. We also did a study on Hurricane Katrina dogs. These were dogs that had been rescued and gone to the large rescue shelters after Hurricane Katrina, that housed thousands of dogs. We asked these folks that transferred dogs from those large rescue shelters to report back to us their heartworm testing. And we found that 49% of the adult dogs that were exported from Louisiana and Mississippi following Hurricane Katrina were heartworm positive, and that the risk was highest in male dogs, intact dogs, and dogs from the guarding and ancient breeds. So again, we had the pit bulls, the bully breeds, Rottweilers, and Akita-type dogs as having higher prevalence. What might be most frightening about this statistic is this is a map of the outcome of these dogs. So they were rescued in Louisiana and Mississippi and then sent to rescue groups all over the United States and Canada. And half of the dogs on this map were carrying heartworms with them. So there likely was some transmission in areas that were not used to dealing with heartworms, but I wouldn't overrate this, because remember that heartworm is already transmitted in 49 states. And so there's no state that got heartworm introduced because of the Katrina dogs. But the Katrina dogs are just one example of the movement of rescue dogs. We saw another one in the last lecture of the importation of dogs from Puerto Rico for adoption in the mainland states. And there is a lot of risk of disease transmission in these programs. And Dr. Crawford's right. I think we do need to start having conversations about how we can run these programs that match the supply of homeless animals with the areas where there's a shortage of homeless animals in a way that protects the welfare of the dogs involved and the cats involved, as well as the health and welfare of the people and the pets in the recipient communities. There are ways to do this responsibly, but there doesn't seem to be a lot of oversight right now, even though there are some regulations that should prevent interstate transportation of infected animals. We've got work to do on this. So what about in cats? There's much less information known about cats, but statistically, most cats are admitted as free-roaming strays rather than owner surrenders. We know that pet cats have a very low use of preventives, less than 5%. And it is also very difficult to diagnose heartworm infection in cats in a reliable way. The tests just don't work as well in cats as they do in dogs. So the true prevalence is unclear. We did a study in our local animal shelter in Alachua County, Florida, and found that we necropsied cats after they were euthanized by the shelter, and found that 1 in 20 dogs, or 5%, had adult heartworms in the heart and lungs. And these cats were all asymptomatic. 17% of the cats had antibodies against heartworm, which means that those cats had all been infected at some time in the past. And in this shelter, 5% were FELV positive and 6% were FIV positive. What this means to me is that heartworm infection in cats is at least as significant as leukemia virus and FIV. What these diseases share is that they are very difficult to deal with after a cat becomes infected, but fairly easy to prevent. And so we should focus highly on prevention of heartworm infection, just like we do for leukemia virus and FIV. But with that in mind, how do we progress as shelters when most shelters are inadequately funded for even their most basic needs, and that has never been more true than it is today with this economy, and that shelters have to perform a lot of risk-benefit analysis in meeting their community needs. And especially open admission animal control shelters have responsibility to the community for safety and nuisance control. And then all shelters are tasked with assuring animal health, welfare, and saving as many animals as they can. So there are a lot of elements that go into meeting these needs, and few shelters that have the resources to do it optimally. So shelter managers have to consider, when they're looking at their budgets and their staffing and space resources, how they can meet those needs the best. And this includes their funding, their kennel space, and their staff, not just in terms of staff numbers, but also staff expertise. Shelters, first and foremost, are working on preventing acute threats to health and welfare, such as parvovirus, panleukopenia, distemper, herpes colici, bordetella, influenza, and other acute threats. And this is where our dogma about giving all dogs and cats vaccines on entry is so important, and that's something that we don't think is optional in shelters. And then there's chronic health issues that shelters also much face, and heartworm is one of those chronic issues. And so parasitism also is important, and then making sure that our shelter pets get spayed and neutered. And many shelters actually lack any veterinary input whatsoever. Some shelters have some contract veterinarians that put some hours in every week, and then some have no access to veterinary expertise. And so they're trying to develop medical programs, including heartworm protocols, all on their own without the expertise that veterinarians, especially those versed in the specific issues of shelter medicine, can provide. There are a number of shelter medicine guidelines that are coming out, and these are very useful, but there are no heartworm protocols yet that are specifically designed for the needs of shelters. You can see here is several different examples of guidelines for use in shelters. So there's a vaccination for cats, vaccination for dogs, feline retrovirus management, and then spay-neuter guidelines. And these are all directed specifically at the needs of animals in shelters, but we don't have that yet for heartworm. What we do have are very extensive guidelines from the American Heartworm Society about the optimal manner for managing heartworm infection in both dogs and cats. And this is really the go-to source for information. You can find them on the internet at heartwormsociety.org, and all of the latest information will be on that website. You can also download these guidelines for free. And I've also put them in your handout so that you'll have them. So what I'm going to do is in this talk is talk a bit about the guidelines from the Heartworm Society. And don't panic because they are quite extensive, but I'm going to talk about where the shortcuts are that we can take when we need to do the best we can for heartworm infection. But in a nutshell, the guidelines say that for dogs, that all adult dogs should be tested, that preventives should be administered to all dogs, and that all dogs should be treated with melarsamine adulticide. And I'm going to spend some time today talking about the pros and cons of using a definitive adulticide with melarsamine compared to slow kill methods with ivermectin. How many of you are relying primarily on ivermectin as adulticidal therapy? Nobody? Or too shy? I think, well, how many of you are using melarsamine? And how many of you would like to do more treatment in your dogs than your resources currently allow you to do? Okay, so I'll give you some tips on using ivermectin when you have to. It's not our first choice, but it is better than nothing. So for cats, they say that the requirement for testing cats is not as rigorous because the tests aren't as reliable. And also, in dogs, before we put them on prevention, we like to test them because there can be some consequences of putting infected dogs on preventives. Also, there's some action steps we need to take if we identify infected dogs because we're going to approach definitive therapy in them. But for cats, we don't have adulticide therapy, and they don't have reactions to preventives if they're infected like dogs do. So the requirement to test cats before starting on prevention is not as important, and the Heartworm Society makes this optional. But they do recommend that we focus on administering preventives to all cats because once cats become infected, we have very few options for managing them, and it is much easier to prevent their infections. And that cats, if they are infected, we just treat them symptomatically to suppress their clinical signs, but we don't have the option of curing them. So why is this significant in shelters? Well, this is a life-threatening infection for both dogs and cats. We have to be concerned in the case of dogs, which can transmit heartworms to the community or within the shelter. So if your shelter has a large number of heartworm-positive dogs and it's in a mosquito-infested area, and you have dogs in the shelter that are not on prevention, you may well have transmission within your shelter just by crowding all those dogs together. It is a treatable condition in almost all cases, but it's expensive and time-consuming. And if you don't address this in the shelter, it is something that your adopters will have to address, and this can be very frustrating for them. So this is a brief trip back to vet school in your parasitology class, just to remind you of the heartworm life cycle. The life cycle is completed in the dog. It is essentially only the dog that can have the complete life cycle. And it starts with a mosquito that's carrying an L3 larvae. And that mosquito feeds on the dog and then transmits it. Within the dog, in a few days, it matures into an L4 larvae. And then, after several months, into a young adult. And then by 6 or 7 months, that adult is sexually mature and can start producing microfilaria. When the mosquito feeds on that dog again, it picks up the microfilaria, and those filaria will mature within the mosquito to the infective L3. So we have to have a mosquito for transmission. If you transmit blood from an infected dog to an uninfected dog, you might transmit some microfilaria, but you don't transmit the infection per se because it hasn't matured through the mosquito. If the mosquito first feeds on the infected dog, picks up the microfilaria, and then they mature into L3, and then feeds on the cat. It's the same cycle, except that in cats, a lot of the L4 larvae never develop into adults. They die in what is called the L5 stage, but there really isn't an L5 stage. It's a young adult. And when those young adult worms die, they cause a lot of pulmonary damage. And I'll talk about that syndrome of heartworm-associated respiratory disease in cats. If they do develop into adults, they can cause a lot of problem when they die. That's probably when the heartworm causes the most problem in the cat. They embolize into the pulmonary artery, cause anaphylaxis and thromboembolism and sudden death. It is very uncommon for heartworms in cats to produce microfilaria. So for that reason, we don't consider cats to be infectious to other animals. So here's a comparison of the difference between cats and dogs when they become infected. Most of the L3 that end up in dogs will survive and become adult heartworms, whereas only 1 to 10% of the worms in the cats will survive. leading to a high maturation in dogs and a low maturation in cats. Microfilariemia is very common in dogs and uncommon in cats. And heartworms, which have been adapted to grow up in the canine host, generally know where to go. So it's not common to see a worm end up in an unusual location in the dog. It can occur, and sometimes we have heartworms that get into the left side of the circulation and into the arterial supply, and they'll come out in the skin and other places. It's much more common in the cat because the worm is not adapted to grow in the cat, so they don't always have a good sense of direction. They might end up in the brain or the peritoneal cavity or another site. Dogs frequently have many worms, often more than 100 worms in their heart, whereas cats usually have only 1 to 3, but sometimes we'll see a cat with 20 worms. And because the dog is the normal host for heartworms, the worms are larger, they live longer, and they are more fertile. So they're just host adapted and they really thrive in the dog, whereas in the cat the worms are a little smaller. So canine heartworm disease, as distinguished from infection. So infection just means the parasite is there, and disease means it's causing a clinical problem. It's primarily a heart and lung problem. It starts out as pulmonary inflammation, which increases pulmonary vascular resistance and right heart failure. So it starts out as a lung disease. If it progresses without treatment, then it turns into a heart disease. And in this picture, we see a dog that has ascites from extensive long-term heartworm disease. The disease progression is influenced by several factors, primarily the number of the worms, how long the infection has been in place, and the activity level of the dog. So a quiet dog with a few worms may not ever develop clinical signs of heartworm disease, whereas an active dog with a lot of worms is likely to develop more clinical signs. And if you remember that map I showed of the prevalence of heartworm infection across the United States, in areas with a higher prevalence of infection, dogs in those areas are more likely to have higher worm burdens. And so dogs in the Gulf Coast and in Florida with heartworm infection are overall more likely to develop severe disease than dogs in other parts of the country. And it is the dying worms that cause the most damage. So when a heartworm dies, it leaves its home in the heart and the main stem pulmonary arteries and embolizes into the distant pulmonary arteries, infarcts lung, and causes a lot of inflammation. There are 4 stages of canine heartworm infection, and we use these stages to guide our therapy with melarsamine. Class 1 is asymptomatic dogs, and those are the ones that are safest to treat. Class 2 are considered to be mild clinical signs or moderate disease, and the classic heartworm signs of coughing, exercise intolerance, or abnormal lung sounds may be found. In Class 3 are the dogs with severe signs. These dogs have all the signs of Class 2, but also dyspnea, heart murmurs, hepatosplenomegaly. They may faint with syncope, have ascites, or die of their disease. Then Class 4 is specifically caval syndrome, which occurs in dogs that have a very high worm burden, and they get lysis of red blood cells as the red blood cells try to get through that sieve of heartworms, causing hemoglobinuria and hemoglobinemia, and that's considered to be the most severe form of heartworm disease, and usually that can only be treated by extraction of heartworms surgically, not use of imidacide. Feline heartworm disease is quite different. This is really a lung disease. Cats with heartworm disease rarely get any cardiac changes. So if you hear a heart murmur in a cat, you need to think of primary cardiac diseases first and not heartworm disease like you would in a dog. They often have asthma-like clinical signs. It's quite likely that we misdiagnose a lot of cats as having asthma when the trigger really is heartworm infection. What is new about cat heartworm disease is we now know that the histologic changes that look like asthma that occur when they have heartworms actually persist a long time after the worms die and are cleared. So even transient heartworm infection in cats can leave cats with very long-term lung disease. And this is why we now recognize that it's quite urgent that we put cats on heartworm prevention, because they are getting significant lung disease, even if they have worms for only a few months. When worms die in cats, these are the ones that are most likely to result in sudden death. And I think the way people usually become believers in cat heartworm disease is because either their own cat or one of their clients' cats suffers sudden death, and they do a necropsy and find some heartworms. Or occasionally you'll have a cat die under anesthesia that's a surprise, and you'll necropsy it and find heartworms. How many of you have diagnosed heartworm infection in cats? How many of you diagnosed it by necropsy? and then how many by antigen testing. So about equal amounts. This syndrome has been termed heartworm-associated respiratory disease, or HARD. How many of you have heard about Wolbachia? So this is a great take-home message from this conference. It is now recognized that every single heartworm carries a bacteria called Wolbachia. And this is a picture of a heartworm cut in cross-section, and the red staining there is the Wolbachia in the lateral cords of this heartworm. And then those are microfilaria on the internal part of the heartworm, and they're also, you can see little red dots where the Wolbachia is there. This is an obligate gram-negative bacterium that resides inside of all heartworms. And it's a symbiotic relationship. The Wolbachia get to live, and the heartworm is actually stimulated to grow and be more fertile. And so it thrives with this Wolbachia parasite inside of it. We now know that a lot of the signs that we have attributed to the heartworms are actually due to this bacteria. And the bacteria are released in large numbers when microfilaria are released from the adult worm, and also when worms die. And they result in a very large amount of pulmonary inflammation when they're released. This is similar to some human filarial diseases such as river blindness and elephantiasis. And in human diseases, they're a few years ahead of us. They've been treating these filarial diseases with doxycycline to eliminate the Wolbachia. And what they have found is then when they come back with adulticide therapy in the humans, that their clinical signs are not nearly as severe as when they don't use the doxycycline. So this has made researchers wonder about the role of doxycycline in treatment of heartworm-infected dogs and cats. And it has been shown now in several papers that are published in both experimentally infected dogs and in naturally infected dogs that if you treat them with doxycycline before giving them adulticide therapy, their lung lesions are much less severe. And so if you take home anything from this conference today, it's going to be that all heartworm dogs deserve to be on doxycycline, and I'll give you several different protocols depending on how you approach treatment. So talk a little bit about the survey that we did of greater than 500 sheltering agencies here in the South where heartworm is very endemic. It included open admission shelters, limited admission shelters, foster programs, veterinary adoption programs, and sanctuaries. And we asked these shelters to describe their heartworm management protocols for testing, treatment, and prevention. And this is a little bit of a busy slide, but you have it in your notes so you can look at it later if you're interested. But what I'm showing you here is the percent of programs that perform heartworm testing. So if we look at the percent of programs that test all adult dogs, in foster programs it's very high. So these programs are handling a small number of animals, but usually providing them with a very high level of care, often supervised by a private practice veterinarian rather than a shelter veterinarian. And they're doing great on the dogs and not so great on the cats. 11% of programs that foster cats will provide all of them with preventive, compared to 98% of programs that are fostering dogs. Limited admission shelters also have a very high rate, this is testing. So limited admission shelters test a very high number of dogs, but a very low number of cats. And open admission shelters, it's even lower. And for some degree, these are because shelters are triaging their resources and they're only testing animals sometimes that are considered to be adoption or transfer candidates. We asked them why they didn't test all dogs as is recommended, and they said that universally the main reason was it was just too expensive to test all dogs. Some said, well, we don't provide treatment anyway, so why should we waste the resource on testing, which is a legitimate concern. Some did not have any access to the tests. These are usually shelters that don't have veterinary assistance. And then in cats in particular, one of the major reasons that they didn't provide any testing was they felt that the risk of cats becoming infected is very low. And I think that's just an awareness problem that vets at all different kinds of private practices and shelters have, is the risk of heartworm infection in cats is pretty high, and it's a pretty dangerous disease. It's at least as high as leukemia virus and FIV, which we do consider to be important to cats. So we need to work on more education for this. And by far and away, the most common kind of test that was used is an antigen test compared to a filaria test. We also asked whether they tested all dogs, some dogs, or no dogs. And the agencies that actually housed animals in shelters are what are included in these pie charts here. And 58% of shelters tested all dogs, 25% tested some dogs, and 18% tested no dogs at all. And then there's much less testing of cats in these shelters. We next asked about their heartworm adulticide therapy, just for dogs, because cats don't get adulticide therapy. And they said that in the foster programs, 99% provided adulticide therapy for at least some of their dogs. So again, very high level of veterinary care that's being delivered to the dogs in foster care. Limited admission shelters also treated at least some dogs, and a little over half of open admission shelters treated at least some dogs. We asked, did they give additional therapy as well in addition to the melarsoprene adulticide? And here's where we have some room for improvement. Only 20% of agencies provided dogs with doxycycline when they were undergoing adulticide therapy. And only 18% were giving ivermectin. And I'll talk a little bit more in detail about why these drugs are very important to be given at the time of adulticide therapy. We also asked shelters, well, if you didn't do adulticide therapy, did you approach these infected animals in any other way? And we found that for dogs, less than 30% provided ivermectin, about 10% provided doxycycline, and almost 30% provided no therapy to infected dogs, and the treatment levels were even less in cats. So then we also asked about the shelter's activities regarding prevention. And foster programs, again, gave preventive to almost all dogs. And they did better on the cats. 31% were giving preventives to the cats. A lot of times this was like in the form of Revolution, which was a broad-spectrum parasite treatment, not just for heartworm prevention. Limited admission shelters also were treating a majority of dogs. And open admission shelters were only able to only 35% of open admission shelters were able to provide preventives to all dogs. Similar stories for why they didn't provide this protection. Too expensive was the number one reason, and a misunderstanding that you could not provide a preventive if you weren't testing. So this is another kind of urban myth that a take-home message from today is if it's not possible to test, you still should be able to consider providing preventive to your dogs. Again, it's not what the American Heartworm Society would recommend as gold standard care, but it is better than doing nothing. And the type of preventive used in dogs, this was kind of interesting to me. 53% used monthly canine products like Advantage Multi or Revolution or HeartGuard, and 44% were diluting livestock ivermectin. And this, again, is not what the Heartworm Society would recommend, but it is something that we recognize is often much more practical and enables the preventive use in a lot of animals that would not be possible if more expensive monthly products were going to be used. So I do think it's appropriate to use livestock ivermectin if it's the only way to get prevention into dogs and cats, but you need to be very careful with it. Most toxicity is due to the use of these products. It's improperly dosed. For cats, the cat groups were more compliant with using the feline-only products, and a smaller number of them were using ivermectin. Let's move now to diagnosis of heartworm infection in dogs. There's two kinds of tests we can use. One is the microfilaria test, and one is the antigen test. Microfilaria are the baby offspring of the adult heartworms, and they first appear in the circulation at least 6 months after infection. So dogs have to be infected quite a while before we can diagnose it. Also, it's not as sensitive as an antigen test. Only 80 to 85% will produce enough microfilaria that you can detect it in the blood. The test is less expensive than the antigen test, though, so it's one reasonable cost-cutting measure would be to screen all dogs for microfilaria and then just use your antigen tests on those that are negative for filaria. It is important that the technicians that are reading these microfilaria tests can tell the difference between A. reconditym and microfilaria immitis. Microfilaria immitis is the heartworm, and reconditym is another filarial parasite that's found throughout the U.S. but is not very pathogenic. The Dirofilaria immitis have tapered heads and tails, and they have motion, but it's not progressive motion, and that's the filaria on the bottom. And the recondite parasite is more slender and has a curved tail, and it has progressive motility. So antigen tests in dogs were used more commonly. The earliest these can ever be positive is 5 months post-infection, but they may not turn positive for several more months afterwards. They detect female worms only, so if there's a very small number of female worms, you can get false negatives. But 199%. Wow. They detect between 95 and 100% of infections. False negative results can result from recent infections, low worm burden, or infections that have male worms only. And there's different formats of these. There's the microtiter plates that you wash, and then there's the SNAP kinds of tests or witness tests that are little devices that you run one at a time. In cats, diagnosis is much more challenging. It's really not a good use of time to run filaria tests in cats because so few cats have microfilaria. Even when they do have it, they usually last only 1 to 2 months, and so this would be a very low-yield test. There is an antigen test for cats. You can get it, well, really you can use any of your canine antigen tests on the cat. They're testing the worm, and the worm is the same in cats and dogs. But now a lot of shelters are starting to experience heartworm testing in cats because IDEXX has added the heartworm antigen test to the FELUC FIV tests. And so shelters and veterinarians now are seeing their first heartworm cases because they weren't really looking for heartworms, but it just came along with the test. So most cats have only 1 to 3 worms, so a large number of cats compared to dogs are going to have male worms only and will be missed on these tests. The triple test is kind of a double-edged sword. It is the same price as the old combo test that you are used to using for just leukemia virus and FIV, so there's not really a financial reason not to use the new test. And it does provide more information about your shelter cats, and it also just generally will raise awareness about the importance of heartworm infection in cats because people are going to be confronted with these positive tests. But I think it does create a quandary for animal shelters when an asymptomatic cat is detected when someone's really just looking for retroviruses when they're screening cats for adoption. And so what do you do with those positive cats when you weren't really trying to test them in the first place? Do you disclose that information to a potential adopter? Do you keep it secret? Do you euthanize those cats that seem to be perfectly healthy except for the positive tests? And there's really no good answers for that. Some shelters have dealt with this simply by buying the old combo tests. It was the intent of IDEXX to phase out the old tests, and the only reason they're making it now is because shelters are demanding it. So they've responded to shelters that just really don't want to have to deal with identification of heartworm-infected cats. Antibody tests in cats are also a tests that are out there. Generally, you send these to the lab, and a positive result does indicate that a cat has been infected sometime in the past, but we don't know they're currently infected. Also, when these tests were first released, it was believed that it was a more sensitive test, but we have now identified many, many cats that are infected with adult heartworms that have a negative antibody test, so we really don't recommend antibody testing for cats with heartworm. It isn't very helpful in the shelter setting. Let's move to treatment now. The goal of treatment in any dogs, whether they're in shelters or in pet homes, are to eliminate the adult heartworms with as few complications as possible. But remember that dead worms are what cause the most trouble for us clinically, and we can't cure heartworm infection without killing some heartworms. So we can expect that complications are part of the treatment sequence that we're going to have to deal with. So there's no completely safe heartworm treatment, and dogs that are clinically ill are at much higher risk for having complications. So we shouldn't take this lightly. We need to have a very professional approach and guided by veterinarians when we attempt heartworm treatment in dogs. And we also want to prevent the infection of other dogs in the community because this is a preventable disease. So according to the American Heartworm Society, the components of effective heartworm treatment include pre-treatment evaluation to assess our patients, to see if they're good candidates for therapy or if they need any special consideration. We want to put them on prevention to clear the microfilaria. I'll talk a little bit about this. Our preventive dose medications will reduce microfilaria. We do want to put them on doxycycline to treat their Wolbachia and reduce the complication rate. We will use a melarsamine, which is a miticide for the adult worms. One of the most important things and the hardest thing to accomplish is exercise restriction, especially as you'll see. I'm going to recommend that we have a heartworm protocol that lasts for months, and it is really hard to confine a large adult breed shelter dog, even in a kennel, with exercise restriction. And then follow-up testing to assure that the infection has been cleared. So the Heartworm Society would say that our pretreatment evaluation should start with confirming infection, and I definitely would recommend this. You know, if the staff has identified a heartworm-infected dog, I would run an extra test under very careful conditions just to make sure that that animal really is infected, that the test was run right, and there wasn't a sample mix-up, because you're embarking on a very expensive and time-consuming procedure. And occasionally we just find out that dogs, there was some kind of mix-up, we don't know why, but they're not really infected. You can estimate the microfilarial burden by running a filaria test, and dogs with high microfilaria counts are more likely to have an adverse reaction when we treat for those microfilaria. We need to be prepared for that. A thorough physical examination, blood work consisting of a CBC, chemistry, and urinalysis, thoracic radiographs, again pre-treatment to estimate how much existing disease is there. And it's very clear, I'm sure, as I'm ticking off all of these, that you're going, yeah, right, that's going to happen. So we need to be practical about what the resource limitations are that force shelters to rely on physical examinations more than diagnostic testing. So there's a lot we can do without spending a lot of money. One thing that is very often not understood about heartworm treatment and prevention is that there is a treatment gap when none of our drugs will treat the worms. So the preventives will only kill the larvae up to mid L4 stage. They will kill L3s and L4s. And the adulticides will only treat the older adults, so L5s and above. And so there's a gap where we can go through all of the treatment appropriately and we're still going to have an infected dog because it had worms at a stage where our drugs couldn't reach them. So we have a strategy, or at least the Heartworm Society has a strategy for treatment that will span that whole development cycle of the heartworm so we don't end up leaving a treatment gap. And this is where we start talking about how long ideal therapy can take. So what they suggest is to start preventive 2 months prior to adulticide therapy. What this will do is it will start clearing the microfilaria, and also that adult heartworms that are exposed to preventive drugs, especially ivermectin, will start to shrink a little bit so that when they do die, they don't cause as much lung damage. This also prevents the maturation of L3 larvae that the dog just got and early L4 larvae into adults. And so we're going to have a smaller number of adults to treat, and we won't have that window of resistance that the late L4s and L5s have to adulticide therapy. It will stunt the immature heartworms, and we're going to continue this preventive therapy throughout and after adulticide treatment. This is something that I think a lot of people don't understand. Very frequently I will see veterinarians say, we don't need to give preventive until after the adulticide's been completed, and that's not true. Remember, the adulticide has absolutely no activity against the larval stages. So if you're not giving preventive throughout this whole time, your dog might be getting new infections while you're treating the old one. So as soon as you've identified infected dogs, they need to go on preventive. This will reduce pulmonary inflammation if we do this pre-treatment and prevent new infections from occurring. All of our dogs also should get doxycycline according to the Heartworm Society. They suggest to give doxycycline for 1 month at 10 milligrams per kilogram BID. The optimal dose of doxycycline is not yet known, but this is a rickettsial-like organism, and that we know that rickettsial-like organisms respond best to higher doses of doxycycline. This will reduce the Wolbachia burden, and in experimentally infected dogs had fewer lung lesions when they were treated with both a preventive and doxycycline before they were given the definitive imiticide therapy. So now we've pre-treated our dog and got it into ideal conditions for adulticide therapy. So we're going to give the imiticide. The imiticide is the only adulticide that's available. It is ineffective in worms less than 4 months old, so a recent infection is a reason for imiticide treatment failure. And recent drug shortages have limited availability of imiticide, but shelters have been prioritized to receive it. So if you have gone to your drug distributor and been told that there is none available, you can call Marielle and tell them you're calling from a shelter for, dog named Joe, and they will give you enough drug for that dog. And I think that was very friendly of Muriel to make a priority of shelter dogs. We explained to them that this was life and death. If we couldn't treat shelter dogs, they would get euthanized for heartworm disease. And so what they're doing is telling private patients at veterinary clinics if they're asymptomatic, they have to wait for drug. But if it's a shelter dog, even if it's asymptomatic, they're prioritized to get the drug. This just shows a dog that's been shaved for its imiticide injections. This is another thing that a lot of folks are not aware of. The Heartworm Society now recommends that all dogs receive the 3-dose injection, not just sick dogs. When this drug was first released, it was suggested that dogs that were class 1 or sometimes class 2 could receive the 2 doses that were given one day after the other, and that the sick dogs would have their get 1 dose one day, and then a month later would get the 2 doses that are required to kill the worms. We now know that killing all the worms at once at the beginning of therapy is likely to lead to much more lung disease, and so the Heartworm Society now recommends against doing that in any circumstance and giving three doses. The problem is this really spreads out heartworm treatment for an extra month. The 3-dose protocol is definitely more effective, 98% reduction in worm mass and a much higher cure rate, whereas the 2-dose protocol only reduces worms 90%, and only 50% of dogs that receive the 2-dose protocol actually are cured. So exercise restriction is essential, and even if this dog were not in a backyard and were in a kennel in a shelter for a few months, he would probably still be doing the same activity. And you've all seen those dogs. The longer they stay in the shelter, the more active they become. But it's been very well established that exercise during heartworm embolization is what is the primary mediator of lung disease, and this can be fatal. So when we send dogs out with adopters after we've treated them or into foster homes, it is essential that they understand the role of exercise restriction. This must continue at least 6 to 8 weeks after the last melarsamine injection. So now we're talking about spreading out melarsamine injections over a month and then restricting exercise another 6 to 8 weeks after that. We're talking about months of therapy or restriction. And when you have a dog like this, that's really a challenge to keep them confined. And when we talk about the low-dose ivermectin therapy for slow kill, those dogs need to be exercise restricted for years until they're cured, which is practically impossible. This does reduce the risk of potentially fatal thromboembolism, which is recognized by cough, fever, and coughing up blood. If they do have these signs, we suggest treating with low-dose prednisone taper. And then finally, follow-up testing. It's best to retest with an antigen test 5 to 6 months after completing the adulticide therapy. You can test sooner, but the dead worms are going to be there shedding antigen for quite a while, and so it's a little more practical just to wait until 6 months later. If it's still positive after 6 months, they do still have live worms, and that's where you really have to make a clinical evaluation to see if it's worth treating those dogs again. If they have just a few worms, it may not be worth putting them through the therapy again. So consider the likely worm burden in the dogs based on your evaluation and the activity level of the dogs before putting them through another cycle of treatment. So here's the timeline as it builds for the American Heartworm Society recommendations. In month 1, you would give the preventive and a course of doxycycline. In month 2, you give another dose of preventive. Month 3, they get their melarsamine at the beginning and the end of the month. They're on preventive, and they get exercise restriction. Month 4, exercise restriction and preventive. Month 5, exercise restriction and preventive. So how many of you can afford to keep dogs in your shelter for 5 months treating them for heartworm? And certainly, even if you do, it's going to impact your shelter crowding and your flow through and all the things we heard Dr. Hurley talk about, compromising the overall health of the shelter. And then if you add in when do we spay a dog, and remember you can't retest them for another 6 months, we're really talking about a 1-year cycle for dealing with heartworms, which is why it's such a big challenge for dogs. So what if you can't do it all? It is very important to understand that some treatment is better than none, and certainly is better than euthanasia because you can't do it the way the Heartworm Society says. So we should all be able to do a pre-treatment physical examination. So our shelter veterinarians should do a very thorough, hands-on evaluation of the dog. And we can start talking about how we can condense this timeline. Well, where can we sacrifice some of the optimal steps here? We can reduce the pre-treatment interval. Instead of 2 months, it could be 1 month or have no pre-treatment at all. You could go back to the 2-dose melarsamine therapy, which is going to save a whole month. Continue to emphasize exercise restriction, though, so that's something that should never be compromised. And keep administering the preventive and the doxycycline to reduce complications. So what we're left with now is a minimum of 2 doses of melarsamine and giving all dogs a preventive and doxycycline. So that's really much more feasible, maybe for a lot of shelters to carry out. I do also think that this is a place to leverage our foster home. And there's some foster homes you'll find they're just good at doing the heartworm dogs, and they become little heartworm convalescent specialists. And that gets them out of the shelter, but you can continue their optimal care that way. I also think that you can develop partnerships with rescue groups that sort of become your heartworm treatment specialists. They're well motivated to help save dogs that have this as their only impediment to adoption. They might be some really nice dogs, and if they could only be recovered from their heartworm infection, they'd be easily adoptable. And so there are little rescue groups that will decide that this should be their focus. And the shelter may provide all of the care, so it's not a financial burden on the rescue group, but the rescue group provides the housing and the exercise restriction. So this brings us now to the other way of approaching treatment of adult heartworm infection. This is known as slow kill. And there's a lot of misinformation on the internet and a lot of, I think, rescue groups that have misunderstood the role of the slow kill approach to heartworm infection. This is definitely less. The problem is the whole time they're infected with live heartworms, they're getting progressive lung damage. And it's almost impossible to exercise restrict dogs for 1 to 3 years. It is appropriate, if you're going to do the slow kill therapy, to add intermittent doxycycline. And this has been suggested that you would give 1 month of doxycycline every 3 to 4 months that they're still infected while you're doing the slow kill protocol. This has been shown to reduce the pathology, the level of microfilariemia, which is what makes dogs infectious to other dogs, and the risk of drug resistance. There is a great concern that's actually increasing among heartworm researchers that keeping dogs on ivermectin when they're infected may actually induce resistance to ivermectin, which would be a disaster if heartworms became resistant to this class of drugs. This definitely is much less expensive than definitive adulticide therapy, and it allows dogs to leave the shelter much earlier. But there are concerns. Older worms are much more resistant to low-dose ivermectin than younger worms are. There was a very nice study in Italy of naturally infected pet dogs that were put on ivermectin as treatment, and they had progression of severity of lung disease. So at least ivermectin alone is not considered to be a good alternative because lung disease gets worse while the dogs are undergoing the slow kill therapy. Exercise restriction is required as long as the dogs are on heartworm, and that's basically impossible for most owners to carry out that long. I touched on the concern that long-term use of the macrocyclic lactones in infected dogs may lead to drug-resistant heartworms. We have seen resistance to ivermectin in livestock parasites and in some human filarial parasites that they're using doxycycline in. So it's not an unwarranted concern. We also are hearing reports, and have been for the past few years, about some dogs in the Mississippi Valley region that are on verified good heartworm prevention that are becoming infected. And so there has been talk that there is the development of macrocyclic lactone resistance to heartworms in that region. And this is the only class of drugs that works against heartworm. And so if we do develop resistance, we may be left without a therapy, a preventive for heartworms. Remember that dogs on low-dose ivermectin, it doesn't kill all the microfilaria. So these dogs may still be microfilariemic and infectious to other dogs. However, if you give them doxycycline, the doxycycline will prevent those microfilaria from being infectious. So if you do the low-kill therapy, you're obligated to also do doxycycline. So this is considered to be a suboptimal approach, but I firmly believe that this is better than doing nothing with sheltered heartworm-infected dogs. And then if you go on the internet, you can find a lot of alternatives to either slow kill or fast kill. And it is important, they're supported by numerous testimonials and claims of efficacy without being toxic. But you should know that none of these products that are promoted as natural remedies or homeopathic remedies or preventives for heartworm have any data to support their efficacy. There's nothing that is approved by the FDA in this line of products. And I don't know how they really even get away with making claims that they are effective preventives and treatments, because certainly, real drugs have to be shown to be efficacious. So this is not a viable alternative. So timing-wise, when should we treat? The long-term outcome is best when the treatments are eliminated early. So this is an infection that causes progressive and accumulated disease of the lungs. Lung damage is likely to become transiently worse following adulticide therapy, so we need to think about that when we're timing our treatment, that we expect to have a time when the dog might actually become quite a bit clinically worse. Debilitated dogs should be rehabilitated before undergoing adulticide therapy. So this is a dog from a cruelty case that is starving, and this isn't one that you would want to start on heartworm therapy right away. You really must get this dog in better shape. We witnessed this after Katrina too. A lot of dogs coming out of Katrina were infected, and we were all very eager to get our dogs treated as quickly as possible so they could be adopted. And multiple shelters reported that they thought they were seeing a higher rate of adverse reactions in their Katrina dogs than they were used to, and it was probably just the cumulative stress of what those poor dogs had been through. So they'd been through a hurricane, they were neglected before that, and then they went to these big temporary shelters, then they were transported all over the place into new places, and then they got adulticide therapy. And very quickly on, a recommendation came out that we should wait a few weeks to a few months with the Katrina dogs before we should treat them, and things seem to do better then. So this brings us to spay and neuter. Is really, when should you spay and neuter? A private practice veterinarian would recommend appropriately that a pet dog be treated for heartworm first, and that the elective surgery be postponed for at least 6 months later. So the lungs have time to heal, and you're performing anesthesia under the best possible circumstances. But remember that most of the pathology we see in heartworm disease is due to the dead worms. So the lungs are always healthier prior to adulticide therapy than the first months after adulticide therapy. So we recommend that shelters always consider doing their spay and neuter surgery prior to adulticide therapy in your mildly affected dogs. So class 1 and class 2 dogs, we usually just go ahead and get their spays and neuters out of the way when the lungs are healthy, and then start treating them because we know they're going to be in care a long time after they're treated. Somebody, I guess, has had trouble arguing that point. There actually is an excellent chapter there's a textbook of infectious disease management in animal shelters, and the former president of the American Heartworm Society wrote a chapter on managing heartworm in shelters, and he agrees with this. He states that in the chapter. So if you need something in writing about doing this, then go ahead and get that chapter. Or just, if you have vets that are concerned about that, have them call us, and we'll talk to them about why we recommend this. And it's not a blanket statement. There are some dogs that are not candidates for surgery, elective surgery, until their lungs are in better shape. But in my experience, the vast majority of heartworm-positive dogs in shelters are pretty healthy, and they're ready for surgery. You can also make them better surgical candidates by pre-treating them with the preventive and the doxycycline. Because remember, we get better lungs and smaller worms when we treat the Wolbachia. So doing the spay and neuter before the treatment is going to condense the amount of time you have to keep these dogs. All right, let's look at what we can do for our cats. So we diagnose heartworm infection in cats, and it is important to understand that there is no adulticide therapy for cats. So it is contraindicated. It's a drug that's toxic in cats, and many cats die when their heartworms die, so we don't want to kill heartworms in cats generally. But we are left with symptomatic care. So if cats have no clinical signs whatsoever, it's nice to do a chest x-ray to see if they have any occult lung disease, if you can. And if they don't need any therapy. If they do have either radiographic signs or clinical signs, similar to cats with asthma, we recommend giving them doxycycline, prednisolone, and bronchodilators as needed to manage their clinical signs. And then, of course, all cats should go on heartworm prevention. In cats, you can get away with giving them the prevention right away because they're not going to have microfilaria, which is what gets you into trouble when you put them on prevention. So there are two groups that have protocols that are recommended for heartworm prevention, and they're essentially the same. It's the American Heartworm Society and the Companion Animal Parasite Council. And they both agree that all cats and dogs should be on heartworm preventives that also have broad-spectrum anti-helminthic activity. So the Heartworm Society is concerned mostly about the heartworms, and the Companion Animal Parasite Council is concerned mostly about zoonotic helminth infections, such as hookworms and roundworms. So luckily, we have a lot of products now we can choose from that treat for all of those. It is now recommended that dogs and cats be on heartworm prevention year-round. We used to try and make recommendations about certain seasons when up north dogs could be on prevention, but the problem with that is compliance. It gets very complicated, and it's so much easier just to say every month they get something that's also going to treat their intestinal parasites and their fleas. The only place we don't think there's transmission currently is in Alaska. There are heartworm-infected dogs in Alaska, but in almost every case it's an imported case. Start puppies and kittens at 8 weeks of age. This I found from our survey is something that is misunderstood. Because you can't test dogs and cats for heartworms until they're 6 months old, there are some shelters out there that believe that you can't or shouldn't put them on prevention until they're 6 months of age. But that is not true. We want to start them on prevention by 8 weeks of age. Remember that preventives don't actually prevent infection. It's a very erroneous term. They kill infections that are less than 2 months of age. So it's a reach-back effect. They kill retroactively those L3 and L4 larvae that are already in the animal. So if you start treating at 8 months of age, you really should be able to prevent any infections. Puppies, kittens, and adult cats can start prevention without any heartworm tests because they're not going to have microfilaria. When we talk about adult dogs, it's a little more complicated. All of the heartworm preventives have microfilaricidal activity. Milbamycin and high-dose ivermectin have very potent microfilaricidal activity, and they will kill all of the microfilaria at once, which is what causes most of the reactions. And dogs that have reactions, they go into shock and can have emesis and can even die. So when we're starting dogs on prevention, we generally recommend using either low-dose ivermectin at 6 micrograms per kilogram or one of the other preventives like Revolution, because those are only going to they kill slowly. It takes many months to kill all the microfilaria with those products, so it's much safer to use. But remember, we also use higher-dose ivermectin for treating some other diseases. So roundworms require 200 micrograms per kilogram, and there are a lot of shelters just for financial reasons and efficiency that treat everybody on intake with a roundworm dose of ivermectin. And generally, my experience is you actually get away with it. I think it's very uncommon to see reactions in heartworm-infected dogs. What do you all feel about that? How many of you are using ivermectin at intake for intestinal parasites? Do you think are you testing for heartworms first or no? No. Do you have reactions? No. Anybody have reactions? So that's my gut instinct from hearing people talk too, is that it's generally very safe to even give those high doses. Maybe because our shelter pets are generally very healthy young animals. But it does mean if you're doing that, that your staff needs to know what a reaction would look like and how to react. There needs to be a protocol, they need to be trained on it, and the drugs all need to be available for how you would treat them. So what we usually expect to see if they're having a reaction is lethargy, salivation, vomiting, they become very pale, circulatory collapse, and the dog can collapse. And it can occasionally be fatal, although not usually. You would treat this with glucocorticoids and IV fluids. So we have other choices that are not likely to kill all of the microfilaria, so moxidectin, selamectin, low-dose ivermectin. And this will cause the microfilaria concentration to fall over 6 to 9 months. But remember, these dogs are still infectious. So if you feel like you need to control microfilaria rapidly, use it is recommended by Heartworm Society to give a dose of low-dose ivermectin once, or selamectin or moxidectin, and then 2 weeks later, use another dose. So you're going to reduce incrementally the circulating microfilaria. And then finally on day 30, use a more effective drug that's going to clear all of the remaining ones. And so that should sort of stage this rapid kill of microfilaria. Okay, what about in uninfected dogs? All of the currently available preventives are macrocyclic lactones. They are very safe and very effective. Again, they don't actually prevent infection, but they have a reach back for the past 1 to 2 months to terminate early infections. They're effective only against L3 and the early L4, but no later stages of infection. They have no efficacy against adults except that sort of extended multi-year slow kill activity. The preventive doses are safe for all herding breeds, but the higher doses are toxic for dogs that have the gene mutation for ivermectin sensitivity. So you can give any of the currently available heartworm preventives to collies and the Australian shepherds and things and not have reactions. But if you give higher doses, then you can actually have some fatal reactions in the breeds that are sensitive to this. So what are our options? We actually have quite a few options for prevention for both dogs and cats. It is ideal to use the FDA-approved drugs with broad-spectrum anti-helminthic activity against the zoonotic parasites. There is also the option of using ProHeart 6, which is the injectable moxidectin that lasts for 6 months. Or, if it is not feasible in your shelter, to use the monthly doses of FDA-approved drugs because they are substantially more expensive than the livestock ivermectin. I think it is appropriate, if done safely and cautiously, to use Ivomec, which is an over-the-counter product, so you don't need a veterinary prescription to get it, but to dilute it very carefully in a product that's appropriate for diluting it, and make sure that there's a dosing chart that all of the staff understand. So if you've got animals in foster homes that are using this, or staff are administering it in the shelter, they need to be very, very cautious because this is a very toxic drug. Most of the reported cases in the literature of ivermectin toxicosis are related to people trying to dose their own animals at home with their equine dewormer or another product. They're dosing errors. So if you can't do it all, you can't treat all dogs with prevention in your shelter. Again, some prevention is better than none. So ideally, you would treat all dogs and cats at least with a livestock product, or at least focus on the animals that you've selected as good candidates for adoption or transfer. Consider using the diluted ivermectin at 6 micrograms per kilogram. And usually the first dose, it would be safest to administer it first thing in the morning because reactions are likely to occur, unfortunately, often 12 hours later, so you're going to miss them anyway. And then make sure the staff is trained to recognize and treat reactions that might occur when you administer these doses to dogs that are already infected. Then it is also important that you have good communication with both adopters and with their veterinarians, because you may be doing some procedures that are appropriate but are not known to private practice veterinarians. And so communication up front is very important so that when that adopter takes their pet to a veterinarian, the shelter's not criticized for doing something sort of non-traditional. So I think it's just really good to have a written sheet that explains your heartworm protocol and why you're using it and how you're using it. It should include a record of all the tests or treatments that were given at the shelter, and very clear recommendations for follow-up with the new veterinarian. So for instance, if your shelter can't afford to test dogs before adoption, your paperwork should say that we don't test dogs before adoption, so one of the first things that you need to do is go to your veterinarian and have your dog tested. And then here are the options for, what you would do with the dog if it turns out to be positive. If you are giving preventive, provide the date that the next dose is due, and assure that all adopters understand the importance of testing and preventive. So don't just give them a handout, because we all know that they're not just going to read it, but part of the adoption counseling, among all the other topics that you have to touch on, such as identification and microchipping and vaccines and introducing to the new pets, it should include a discussion of how they're going to manage heartworm at home. So to summarize, heartworm infection is a very important threat in shelter pets, and it's very challenging because of the expense and time that is involved with managing it. Some shelters, based on our survey, have developed very inappropriate guidelines in the absence of veterinary input. And so I do think we need to get a written document developed that is blessed by experts about what is appropriate for managing dogs in shelters, especially if the optimal guidelines can't be followed. I do consider heartworm disease, except in the most severe cases, to be a treatable disease. So if you're categorizing animals for Asilomar accords or other methods, heartworm infection should usually be in the treatable category. But because it's so difficult to treat in the shelter, it's frequently a cause of euthanasia of otherwise adoptable pets. It is very difficult, I think, for most shelters to comply with the AHS guidelines. I think that's rare for shelters, even really high-end shelters that have a lot of resources to completely comply. And so we should work on doing the best we can and cutting the corners that are appropriate to cut, and really working out systems for leveraging foster homes or rescue partnerships to provide the care of animals during the extended recovery time from heartworm treatment. And then I would make a call for industry and veterinary support to subsidize the testing, prevention, and treatment of dogs in shelters. Right now, these pharmaceuticals and these testing supplies are just too expensive to be used frequently, especially in shelters that have large numbers of animals. And we need some subsidies to make treatment more accessible. And many of the companies actually do help, like IDEX has a shelter program where their tests are sold at a 40% discount to shelters. Mariel has not been discounting Amiticide to shelters, but they've been making it available during the shortage to shelters as a top priority. And I think we need to ask our industry partners to do more to make therapy and management more effective in shelters. And I'd finally like to thank our friends at Maddie's Fund for making our program successful. They do fund our faculty at the University of Florida, as well as our residency training program and all of our many of our student training programs and consultation training that we do, and conferences like this. And we wouldn't have our program if it wasn't for generosity of Maddie's Fund. So thank you all.